Throughout history, chemical weapons have been used in one form or another. The earliest form of chemical warfare was the use of spears, arrows, dipped in poison. The Spartan mixed pitch and sulfur and ignited it to create toxic fumes during the battle in order to incapacitate the army or the enemy. Other armies dipped cloth in poison and lit it to create a toxic cloud over opposing armies. There were simple forms of chemical warfare, and it was not until recent history that it was used on a large scale. If there was attack today, would you be ready? Today we're going to discuss three things. We're going to talk about nerve agents, blood agents, and vesicants, also known as blister agents. My main sources of information come from the NAVEDRA 14295 Bravo, also the NAVMED P5041, and additionally the Air Force J-Man 44 TAC 14 manuals. Let's begin by understanding the most common and deadly agent of all, nerve agents. Nerve agents affect by interfering with the normal transmission of nerve impulses in the parasympathetic autonomic nervous system. Pharmacologically, these nerve agents are cholesterol inhibitors, interfering with the normal transmission of your nerve synapse. Essentially, your body does not have the ability to communicate from nerve ending to nerve ending. Their reaction with cholinesterase tends to be irreversible, and the reaction time varies according to the NAVEDRA 14295 Bravo. The names of these nerve agents are GA, which is Tabin, GB, which is Sarin, and GD, which is Soman, and additionally VX. These agents can cause a wide range of signs and symptoms based on the exposure amount and the exposure time. These agents for mild exposure can start with constricted pupils, runny nose, or even just nausea and vomiting. If you are exposed to a large amount for a long amount of time, you could have trouble breathing, you could have loss of consciousness, and worst case, you could go into muscle spasms and have the inability to breathe. These agents will traditionally be odorless, colorless, liquids or vapors, varying greatly in viscosity and vitality. According to the NAVEDRA 14295 Bravo, they are moderately soluble in water and fairly stable unless a strong alkali or chlorinating compound is added. Though deadly, these agents are treated easily. Immediate treatment is delivered by an autoinjector that contains 2.1 milligrams of atropine and 600 milligrams of 2-PAM chloride. Non-medical personnel are able to deliver 3 autoinjectors, and if you are a medical personnel, you are able to deliver as many as you need to treat your patient. Nerve agents are deadly and have immediate effects on your body, but blister agents possess a delayed effect that can lead to life-threatening consequences. Per the NAVED 5042, Chapter 4, it states, blister agents, also known as vesicants, are likely to be used to produce casualties and force opposing troops to wear full protective equipment. Blister agents are used to degrade fighting efficiency and rather than kill, although exposure to such agents can be fatal. The names of these agents are sulfur mustard, known as H or HD. You have nitrogen mustard, which is known as HN, and lewisite, which can be mixed with HD, and also some halogenated oxamines. Sulfur mustard is an oily liquid that is ranging in light to dark color. When exposed to patients, it will inhibit the following signs and symptoms. Upon 12 to 36 hours post-exposure, patients will exhibit redness, skin lesions, necrosis, and even severe cases, pulmonary complications or gastrointestinal complications that could lead to long-term disabilities or death. Nitrogen mustards appear as a pale yellow liquid. Unlike the other, they have a very distinct fishy smell. Their effects on the body range from eye irritation, itchy skin, laryngeal edema, and also necrosis. And for treatment of your patients, you can reference the Air Force J-Man 4414, Chapter 4. Treatment can be achieved in 2 steps or phases. First, you're going to want to decontaminate your skin and remove all agents that you've been exposed to keep it from persisting on your skin or worsening. The second phase is going to be supportive care. While mustard agents or blister agents do not have an antidote, you can manage them through supportive care. If it is skin exposure, you're going to want to clean the affected area and deliver antibiotics to prevent any infections. If you inhale the agent, you're going to want to provide additional oxygen. Your patient may be exhibiting signs that are associated with difficulty breathing, and if you're able to boost their oxygen, that is a supportive care treatment that you can provide. Also, if your patient is exposed to it through their GI tract or gastrointestinal, the exposure can be managed by diet restrictions and also antibiotics to hopefully prevent any further infections that your patient may be exposed to. Once again, blister agents are non-lethal, but their side effects can produce life-threatening outcomes, and if not managed early, your patient has the potential to die. Next, we're going to discuss an agent that is rapid acting and lethal, blood agents, also known as cyanides. What they do is they inhibit your body's ability to absorb oxygen, your red blood cells. The two agents that we'll talk about is AC, hydrogen cyanide, and cyanogen chlorine, also known as CK. These agents disrupt your body's ability to utilize oxygen at a cellular level. An affected person will be starving for oxygen. You can identify this agent by a faint bitter almond smell. Additionally, it can be treated with several interventions. The first line of defense is going to be amyl nitrate, and that's going to be followed by sodium nitrate and sodium thiosulfate, which is going to be given via intravenous therapy. So let's review the highlights. Today, we looked at various chemical agents utilized by terrorists. We looked at first, nerve agents, second, vesicants, also known as blister agents, and finally, we discussed blood agents. Now, on April 6, 2018, Russia told Britain that at the United Nations Security Council, you're playing with fire and you'll be sorry, over its accusations that Moscow was to blame for the recent attacks. I was raised to be safe than sorry. The ability of agents is real, and the threat is a real global wide. I hope that you have been able to read this